There are two settings where carotid artery stenosis is diagnosed. One is in patients that have a family history of carotid artery disease, and they are smokers and they have high blood pressure and have high cholesterol, diabetes. I think it's important, if patients are in those risk factors, to talk with the primary care physician to see if they are good candidates for heart screening. The other circumstance is when patients present to the hospital with stroke symptoms, and in the workup of the root cause of the stroke, there are images of the carotid obtained showing the narrowing. And in those patients where we can find the problem, we can really help them by targeting our therapy, both medically and with surgical interventions. At Mayo, we have clinics which are multidisciplinary, and basically they have specialists which involves neurology, stroke neurology, cardiology, vascular surgery, and neurosurgery, where we work together to understand why a patient had a stroke. If there is a significant narrowing, the treatment on top of the medical management includes basically repairing the artery. And overall, there are 3 techniques that can be used, but there are certain features within basically each patient that makes one option better than others. What we learned in the last decade or so was that in addition to the narrowing, the reason of the narrowing in the artery is critical. And if there is, for example, a hemorrhage within the plaque or a bleeding within the plaque, we can prevent strokes by fixing the artery, even if there is no significant stenosis or narrowing. To see the plaque, you need the technology. And at Mayo, we have specialized MRIs to see those problems in the arteries. At Mayo, we're really pioneering basically a change in that dogma. And we have basically the largest published series of patients undergoing surgery for minimal to no stenosis, and showing that we can really prevent recurrent strokes. So it's always good for patients to try to go to centers that they're very familiar with all the available options.